So fortunately or unfortunately, depending on how you look upon it, unfortunately though, infectious diseases, there's always new ones emerging and changing. And besides talking about pandemic influenza, avian influenza, SARS, which is a brand new virus that until a couple of years ago we never heard of or seen. So certainly there's a potential for new viruses to come and very rapidly travel. But also there's this whole idea of emerging infectious diseases, and potentially we can think about even bacteria that are becoming resistant to antibiotics. This is becoming a huge problem, particularly in the developed world like the United States, where we use antibiotics very indiscreetly. Physicians write them, other healthcare providers are giving them out. Patients have expectations that you have a little sniffle, you have a little cold, runny nose, sore throat, you need an antibiotic. When in reality that's not the case, but unfortunately with the sort of gross abuse of just distributing antibiotics to anyone who sort of requests them, we have developed all these superbugs, even within the United States now, they're actually resistant to the typical antibiotics that we use. This is a very scary situation because the reality is we just don't have the technology or the manpower or the infrastructure to just keep developing drugs as rapidly as we need to fight all these sort of mutations and changes and resistant strains that are developing within particularly bacteria. It's a big, big problem. And you're going to find, and it already is becoming in the news in the last year, a lot of people have heard a lot about MRSA, which stands for methicillin-resistant Staph aureus. And this was a problem that 10 years ago was just limited to intensive care units and hospitals, and now it's become a large community problem throughout the United States, particularly in urban environments. We can find that potentially up to a third of people actually carry methicillin-resistant Staph aureus as a cause for infection. And the typical antibiotics that we're used to using do not work. Fortunately, we still have other antibiotics that are effective against MRSA, but you know what? These bacteria are smart, and they're a lot smarter than people anticipate, and they're continually evolving and figuring out how they can survive. Just like what Darwin would say, it's survival of the fittest. And viruses and bacteria are very smart at doing that. They're very creative and bright organisms that really can, as I mentioned before, they've been here probably before mankind has, and they will continue probably to be here. Hopefully we won't succumb to anything, but they'll probably be here longer than the rest of mankind. I mean, they are here to stay, and they're going to continue to be a challenge, and we need to anticipate these challenges and be aware that we are actually causing a lot of these problems by even giving antibiotics inappropriately. So, we think of emerging infectious diseases can be rare diseases like Ebola that potentially can come over from Africa, but they can also be homemade here in the United States. Other things, to a lesser degree, I don't think we need to, not to be an alarmist, but certainly there are unfortunately the idea of bioterrorism and agents that actually are super designed to be resistant to typical antibiotics or typical vaccines that we might use against viruses. So these would be another sort of class of emerging infectious diseases that are potentially a challenge that we might face here in the United States.